Hi, I'm Jack Canfield, and welcome to this week's show talking about success. My first guest is Dr. Jim Roach, known as America's Healer. He's a #1 Amazon author. He's now written a new book called Vital Strategies in Cancer, which give incredibly meaning lots of references of research, groundbreaking insight on how to achieve cancer outcomes at a level way above what most oncologists ever even hoped to create. And as a researcher and published author in this world, as a national speaker, one of the most comprehensive understandings of integrative strategies in the world. And I like to say a friend, someone I really respect and admire, who knows probably more than Wikipedia could teach you about all the things that he's researched. When the rest of us were watching TV, he was reading and experimenting and doing research with clients and healing people that were not supposed to live. So I'm really thrilled to have you join me, and I wish this was a 2-hour show instead of a short interview. But anyway, so let's jump in. And you're on a mission. You're clearly driven with a powerful mission. What got you on this mission? You're not the normal doctor that I meet. You're someone who is just passionate about what you do and very successful at it. What got you to go the extra mile?
First of all, my father had prostate cancer. The urologist that was treating him told him he needed to have his genitals cut off, and always get a second opinion. That's the take-home message from this presentation. And I heard a speaker, the top botanical medicine expert in the country, Donnie Yance. His knowledge was head and shoulders above everyone else I'd ever heard on this topic. I had to learn from this master and went out to Ashland, Oregon, ended up going out there 3 times. And I've accumulated thousands of studies that Donnie Yance has sent down to me, and accumulated so many wonderful ideas, so many important ideas for improving outcomes. We can double, at least on average, the outcome for patients with cancer in terms of improved quality of life, in terms of longevity, but also reduce side effects from chemotherapy and radiation by half. My patients don't get chemo brain issues.
So what is chemo brain?
Chemotherapy affects the whole body, not just the area targeted for treatment by the cancer. So the chemotherapy attacks brain cells and weakens your ability to be able to remember, to be able to focus. It can impact your mood. It's one of the major consequences that patients suffer as far as chemotherapy.
Now, we were talking earlier, I think you said something about chemotherapy and radiation. Also, talking about cancer stem cells and how it actually releases those in long-term, short. Can you tell our viewers about that? I think that's really important.
Chemotherapy goes after, and radiation as well, go after rapidly multiplying cells. And that's why the tumors shrink and you think things are going really well. But cancer stem cells are not rapidly multiplying. They are hanging back, and then they get a distress signal from the dying cells. And the dying cells are saying, you've got to help us survive. You've got to start multiplying. And so the cancer stem cells do, and then they break loose and can form metastasis. So actually chemotherapy and radiation in many instances can lead to metastasis. However, there are 50 different nutrients, at least, that can help neutralize those cancer stem cells and that are crucial. Another key point that I want to make just generally is that when you're diagnosed with cancer, there's a 4-fold greater risk for heart attack, stroke, thrombophlebitis. And if your doctor is not addressing that, you may die from a heart attack unexpectedly, or even worse, maybe have a stroke and be paralyzed. That doesn't need to happen. In the 10 years that I've been treating patients, none of mine have happened, but I've had 2 patients I can think of, particularly one who ignored my advice, had a heart attack and died just a month after they saw me. Another that developed severe thrombophlebitis. They had veins that were like ropes, the most horrific sight that you can imagine. And taking care of that, it's not necessary to have those issues.
Now here you are, and I know a few other doctors too, you know some of them are mutual acquaintances of ours, that are proposing these new holistic, integrative practices, medicine, of treatments, and yet our medical system doesn't seem to be picking up on that too much. Why is our current state of cancer treatment such a mess, in my opinion, and I think yours as well?
There are financial incentives to go the pharmaceutical route, to go the chemotherapy route, because it makes money for hospitals. So every clinical trial is a source of income for these facilities. And oncologists, even if they want to go a different direction, the chief head of the hospital tends to emphasize the financial side of things. But there's a pioneering doctor that I know, for example, that does ablation therapy. For example, with smaller tumors, freezes the tissue, which leads to cells being released that the immune system can recognize in some situations, so that even if you don't freeze all of the cancer cells, that your immune system can wipe out all the other cancer in your system. And particularly if you combine that with the new checkpoint immunotherapy drugs, a doctor that I'm utilizing as a consultant is having wonderful success in that combination. But it's not something you will find ever recommended at a conventional medical institution.
Now, you talked about stress in your book as well, and the importance of reducing stress, and how even a cancer, when you're diagnosed, creates a lot of stress. So talk about that.
Well, my PSA level, the prostate tumor marker, jumped to 12.5, and my reaction to that was panic. My father had had prostate cancer, nearly died from it. And I remember that panicky reaction. Research done in rodents showed that mice that were implanted with tumors, when one group was stressed, that group had 30-fold increased incidence of metastasis, spread of cancer in their bodies, just from stress. So it may be the single most important intervention of all to get in a peaceful spiritual place at the time of my first diagnosis. And one way to do that, I've had 50 patients with spiritual near-death experiences. They report that the other realm is more real than this realm. They get mad about coming back. They're not afraid of death anymore. If you're following your spiritual pathway, making the world a better place, if I do everything wrong, if they do everything wrong, then outside's ultimate bliss. On the other hand, if you've messed up, and I had an alcoholic patient, he had a negative near-death experience, shook him up. For the next 2 years, he did everything he could to make amends. He stopped drinking. 2 kids he'd left alone. He set up trust funds, and then 2 years later, he had another near-death experience. This time it was blissful. So, and you may say, well, God, I appreciate I get to graduate now because I've achieved your goals on the earth, but I've got this grandson I need to take care of. So let's have a conversation about that. And there is wiggle room for you to achieve your full spiritual mission if you'd like. And God will shine kindly on that situation. There were a lot of wonderful integrative strategies. That's the neat thing. There's so much knowledge and information and clinical experience now to help you achieve the outcome that you want to achieve.
So things like meditation, mindfulness, prayer, relaxation, breathing exercises, all those things.
And even exercise is more effective than chemotherapy.
Well, say that again.
Yes, exercise is more effective than chemotherapy in improving outcomes. Study after study after study. But yes, combined with prayer, with meditation, there are also a lot of wonderful supplements. For example, inositol, IP6, or L-theanine, are examples of ones that hit cancer markers, but also help achieve peacefulness that your practitioner can use with you.
Very cool. Very good. Anyway, I'd like to ask you a million more questions, but I won't. Along those lines of nutrition and all these different supplements we can take and so forth. So give us some examples. You mentioned one patient you had. Tell us about some success stories.
I had a postmenopausal woman who presented with a goose egg breast cancer, 9 centimeters, which is basically 4 inches in size. And the temptation might be to immediately get that removed. But I knew that we might be able to shrink that tumor down much smaller and make it much simpler to remove. And further, that would give time for the cancer expert, Dr. Williams, that I use, to be able to freeze that instead of having to burn that, which would improve the outcome. So I put her on a prescription estrogen blocker, and in 3 weeks' time, that tumor shrunk to 1/10 the size, 4 centimeters, which is actually less than 1/10 the total volume originally. So it was much easier to go in and freeze that than it would have been otherwise. And it's been 7 or 8 years, she's doing wonderfully. I had a patient who was told that go home and die. because we've done everything we can to help save you. And I started him on an integrative program. The first month, his PSA, the prostate cancer marker, dropped, but then it started rising. But his vitamin D level was only 17. I put him on more and more vitamin D. I couldn't get that up until I had him on actually 50,000 units of vitamin D3. And then his level normalized, and then his PSA level, in conjunction with the whole integrative program, started to drop. It went from 225 to 220 the next month to 215. But then he wanted to try to go further. He went to a doctor in Texas who said, stop all those supplements. 2 weeks' time, his PSA zoomed up 100 points.
Wow.
And the cat was out of the bag at that point.
Unfortunate.
Yeah.
So there are a lot of myths about cancer treatment, and you and I have discussed some. Anything you'd like to point out?
One thing, it's a psychological emergency when you're diagnosed, but it's not a medical emergency. You don't have to rush in and immediately go in and have that cut out or burned or zapped. Particularly if you can get on a good integrative program right off the bat. Locate an integrative health practitioner who has experience in dealing with cancer, get on a good program, and then take a step back and research and study and learn how to manage this. And you can have much better outcomes if you just take that time to do the research. Get in a peaceful place in this process. Get spiritually grounded. You need to forgive. Forgive yourself completely and forgive everyone else completely so that you can release that yoke, that burden that you've been carrying around that may have actually triggered the tumor in the first place. And that will allow your immune system to strengthen, to allow you to heal.
I have a friend who was getting very, very ill and thought she was going to die. She was in her late 70s, early 80s. And someone said, you got to go to Hawaii, see this healer. Healer had her lie down on what would be like a massage table, treatment table. And 6 hours. Who do you need to forgive from last year? Go back to the year before that. Who do you need to forgive? 6 hours. Forgiveness. Everyone all the way back to her childhood. 2 days later, she was fine. Everything.
Find a practitioner like that to deal with you. It's so critical. We all carry this baggage that makes us ill. Cancer is a blessing for so many because it's a time to reinvent your life. You can do what you want now, and you can go through a metamorphosis and emerge as a butterfly, and it can be a wonderful experience to strengthen your family ties and to rebuild bridges you've burned.
Now, I know you want to speak to a lot of people and get this word out there, and also you have this new book. So if people want to find out about your book, they want to find out how to book you for a speaking engagement so they can bring this information to their community, whether it's a church community or a city community, a local community, well, how do they contact you?
My website is www.vitalstrategiesincancer.com. So go to the website and you can pre-order the book there if you'd like to do that. If you want to book me for a speaking engagement, call Jennifer at 859-846-4453. She can get you booked for a speaking engagement. I'm happy to travel anywhere in the country. I need to get this message out as much as possible. Also, if you're a healthcare practitioner and want to learn more, go to www.drroach.net, roach.net, and we can teach you how to manage cancer and other major integrative health problems like autism and ALS. We treat problems in our office that other doctors can't fix.
I believe you. I can see it in your eyes, see it in your face. You are someone doing really good work. Well, I hope with this show we've helped get the word out to a whole bunch of people, and I just wish you the best because you are doing such good work in the world. Thank you, Dr. Roach.
Well, you are too. Thank you, Jack, so much.
My pleasure. Thanks for joining me. Well, you heard it here. Check out the book. If you have cancer, if you know someone who does, if you are wanting to just stay healthy so you don't get it in the first place, check out this book and stick around. We'll be right back after this break.